So here at Optimal Health, one of the foundational ways we assess the body, and especially when it comes to musculoskeletal pain, meaning muscle and joint pain, we take a muscle imbalance approach. Within the body, we can almost divide the body in half, upper half, lower half. The upper half and lower half, we often, in similar patterns, develop what we describe as muscle imbalances. Certain muscles in the body tend to become tight, and if something's tight, something's relatively weak in return. So that becomes out of balance. When our body's out of balance from a muscle firing standpoint, that's going to put faulty pressure on the joints. That can lead to arthritis over time, can lead to overusing joints and pinching a nerve, if you will, or maybe a bulging or herniated disc. So what happens when we look at the upper body? And we'll put a chart up here for you. Certain muscles tend to overfire. The one are upper traps and levator scap. These are the muscles that lift the shoulder. They tend to overfire on us. With that, our pec minor often overfires as well. So our shoulders not only shrug, they will round forward. So we got tightness in the pec minor, tightness in the traps. As you can see, that's starting to put pressure on my neck. That'll then force an anterior head carriage, and then we develop a lot of tension in our suboccipital muscles, base of the skull in here. That can often lead to headaches, those type of things. So when we're assessing somebody with really just upper quadrant pain, whether it's neck, shoulder, headaches, we're often looking for many muscle imbalances within that pattern I just described. And in there, that's where we're directing our soft tissue techniques, our active release technique, or doctor-assisted stretching, or postural advice to help undo those muscle imbalances. With that, oftentimes we often want to then strengthen the opposite muscles. So if the traps are tight and they lift the shoulder, we want to strengthen some of the lower trap muscles and serratus that helps bring the shoulders down and relax that area, allowing our neck to fall back into a more neutral posture.